Welcome to How to Speak Cancer, the podcast. I'm Catherine Kunze, a medical communicator, a translator, and a former nurse. At How to Speak Cancer, I translate cancer and medical language into clear human words so you can understand what is happening, ask better questions, and feel a little less lost. This is episode 2, and really the first episode where we start diving into the topic together. In this podcast, I will keep things short and simple on purpose because I know that this topic can be a lot to take in. I know that you might not have the capacity you usually have in your mind to digest heavy things. Well, we'll go here one step at a time and I take it very slow and very easy. Today we're going to start with what is cancer? If you're watching this on YouTube or Spotify, you will see some slides along the way and some images I created. But even if you don't, if you just listen, don't worry. I will describe everything in a visual language in very simple terms so you can understand what I'm about to say to you. This podcast is based on my book How to Speak Cancer, and there is a whole mission behind it. We want to make medical language clear, more human, and easier to understand, especially in those moments when clarity really matters. If you'd like to learn more about the book, the project, or the different language versions we are having available right now, you are welcome to visit my website www.katrinkunze.com. Of course, you will find the link in the description. But now let's start. So, what is cancer actually? Cancer is a word that carries a lot of fear, of anxiety, maybe uncertainty, and many people are very afraid of the word cancer itself. So, I'm here to make this all a bit clearer for you. It's often not just the disease that is overwhelming, it's often the language around the disease. We know that heavy terms, medical terms, lab reports, all this can be very hard to understand. And this is why I started to create this podcast to tell you a bit more about it. So let's start at the very beginning. What is cancer? I use, as I said, visual language. So now I want you to imagine a garden tool. We buy garden tools new, we use them, they get old, they get rusty, they get faulty, and then we usually dispose them. But now I want you to imagine that we collect all the garden tools onto a pile in our garden. And this pile is growing and growing and growing. This is exactly what happens in solid tumors. We have cells that grow when they shouldn't grow anymore. We have cells that don't die when they should. And those cells often even duplify, like become more and more. They want more and more of those faulty old cells. So our body doesn't really listen to the signals we usually have when cells need to die or when cells shouldn't grow anymore. When we have a lot of cells piling up, then we will feel a lump somewhere in our body or maybe see it when it is in the digestive tract. So this is what we in the medicine call a solid tumor, something we can grab, something we can see, some real change. But I need to tell you that not every tumor is already cancer. We're going to go to this a little later. But for now, just know that a pile of old faulty tools in the garden are like a solid tumor in your body. Now, what is the opposite? The opposite are blood tumors. They don't have a solid lump or a tumor. You can try to imagine it like some poison that is like some canister of poison in your garden. and it's leaking. And this poison is more and more polluting the water, which is taking care of the garden. So instead of helping our plants to grow and be nice and have nice fruits and vegetables, this poison actually does exactly the opposite. So the plants will die. They might or might not have fruits if it's not a lot of poison. But it's suffering. The garden is suffering from this system change because the poison is taking an impact on the whole system. This is exactly what happens when we have a blood tumor. As I said, we don't have the solid lump. We don't have a tumor. We can't locate it like it's here in my arm or it's in my breast or it's in my neck or somewhere. It's basically it's everywhere. It affects the blood, the bone marrow, the lymph system. So everything that is fluid in our body, you can imagine that like the water running through our gardens. And if there are faulty cells in there, those cells will be everywhere, right? And those faulty cells will also have fights with your healthy cells. And this is then what we call a whole system affection. So the whole system of your body, you will have symptoms that are affecting the whole system. That you will be tired, you will be unconcentrated, and all this. So we go and dig into this deeper later on. But for now you need to know there are solid tumors which are placed and which are locatable, and there are blood tumors like poison in the garden, which are running through the whole system. So often then we think like, does cancer spread? Can cancer, go around the body and or will it stick to one place? Obviously, the blood cancer is gonna be everywhere. It's like the same for lymph cancers, all the fluid that is going through our bodies, like we just talked about. But some cancers, like solid cancers, when they are real cancerous, as we say in medical, that means when they are not the good ones, but the bad ones, like we will go into that later on. There are different types. And as I said in the very beginning, not every tumor is cancer. So if we have the cancerous tumor, then some of those cells can move through the body like seeds that are blown through the garden from the wind. Can imagine this also as some cancer cell from a solid tumor. Let's say we have a breast tumor, and one of those faulty old cells will move into our blood, and then it will get transported to some other place in our body. This can be some other organ. This is then not a blood cancer, it's a cancerous cell from a solid tumor that is moving through the blood. It's like like a water hose transporting water, and when there's something in the water, then this is kind of the same image. We call this process in medical language metastasis. And yes, but it's very important that you understand that not all cancers spread, and the earlier you catch it, the earlier someone finds a cancer, the better it is, because the lesser the chance that it will spread through your body. Why understanding all this matters to you? Well, understanding always helps to explain how cancer cells behave. So if for yourself, it's very important that you understand what is going on in your body. Also, it makes it easier to understand medical terms when you talk to your doctor. So when you understand terms like blood cancers and solid tumors, you're already on a better base to discuss, yeah, your condition with your doctors. This goes for many terms, not just for those two terms. And we will dig deep into more and more terms, and we get more and more into also diagnostics and therapeutics. But for now, I need you to understand that it's very important that you keep updated and that you think about what is going on in your body. And this helps people also to reduce their fear, to maybe if you clarify what is going on in a simple way, then patients are usually more attracted to following the process, the therapeutic process as well. Also, you should make decisions, therapy decisions, which are informed, and this can only happen if you really understand what is going on. This is why this podcast was founded and why I wrote the book to the podcast, because I really believe that you only can be successful in your journey when you really understand what is going on. And I want to be a part in this and want to help you to reach that goal, to understand. Well, what is next? Next, we will talk about the hallmarks of cancer. This is important for everyone who asks themselves, why do cells grow uncontrollably? Why don't they die when they should die? And why do they spread? And why does the immune system don't kill them? Why does some treatment not work? So in the next episode, we will talk about the hallmarks in particular. There are 8 hallmarks, and we go through them, and I will let you know why and how the cancer behaves and how the doctors actually diagnose this. If you have any questions, please always feel free to reach out to me, either here on your favorite channel, if it is Spotify or YouTube or Apple Pod. Just leave me a message or send me an email to contact@katrinkunze.com. Or you're always welcome to visit the blog to this. I'm writing a blog along this podcast, so then you can get some more detailed information. And if you want the full book resource, I also have a link provided to this. Yes, but for now, this was a very short episode. We are going to get longer every time. But for now, I hope this is a first impression. Now, I'll see you later in the next episode. And I'm staying with you, right? Never forget, I care for you.